I am Dr. Farhad Bukhari. I am a plastic surgeon certified by the American Board of Plastic Surgery. Today I will talk about aesthetics of the breast. This is one of those topics which most of the women consider as important but do not discuss. As we know, breast has not only importance in terms of physical beauty but has psychological impact as well. This is one of the features which women consider extremely important in their well-being, both physically and socially. Now, what are the areas we deal as plastic surgeons? Essentially 4 areas. One is breast augmentation or breast enlargement. The second is mastopexy or breast lift. The third is breast reduction, and the fourth is breast reconstruction. I'll just briefly touch bases on all of these areas. Breast augmentation means to make the breast larger. Some women have small breasts which are not balanced with the rest of their body. Of course, they want to look beautiful both in their dress and their swimsuits, so they want to make them larger, whatever means we have. So how we do that? Essentially, it is the breast implants which are used worldwide, though there are other options which we can discuss in a separate topic, which are fat injection and macroneedling. But today I will just mention the breast implants are inserted in the breast through an incision which is under the breast or around the nipple and sometimes in the axilla as well. What we use, there are 2 types of implant. One is a silicone gel implant and the other one is a salt water filled implant or a saline implant. Through the small cuts, the implants are inserted and give the enhanced look of the breast. The sizes of the implants vary from small to medium to large depending on the height and the frame of the person. The second topic is breast lift. What does it mean? Sometimes after pregnancy or weight loss, the breast begins to sag and it does not look as attractive as it used to be. What has happened? The skin envelope has become larger than the breast tissue. So what we do? We just remove the extra skin and that lifts the breast up. Although there is scarring with that because we have to make a cut around the nipple and other cuts in the midline and at the bottom, but the look is much better than the sagging breast. It has to be discussed with the patient and they have to accept the scars to get the uplift and the better volume what they desire to do. The third one is breast reduction. In my opinion, it is not really all cosmetic because many women who have large breasts, they suffer from back pain, shoulder pain, difficulty with exercise, and they have sweating under the breast which can cause rashes. So they're really not comfortable. They really need this surgery to make them feel better both physically and emotionally. So, breast reduction is essentially reducing the breast to bring it to a more normal size which fits the person's body and their physique. What we do, we remove the breast tissue along with the extra fat which also lifts the breast at the same time. The fourth one is breast reconstruction. What does that mean? It is for those unfortunate women who had their breast removed for some reason. Mostly it is because of cancer. As I mentioned earlier, breast has an emotional component. Once it is removed, the women feel they are not complete any longer. So not only it improves their physical balance, it satisfies them emotionally as well once you reconstruct the breast. There are many options. Again, one is the implant, and the second is their own body tissue. We can remove the stomach fat and muscle and lift it to the breast to make a new breast altogether. It requires sometimes maybe one surgery, sometimes more than one, but the results are quite acceptable, and really the women start to feel much better about themselves.